Our health is important, and the health of our children and families is fundamental. Like you, those of us who work at the Florida Department of Health hold this value dear. Over the years, pesticides have helped our agriculture system become more productive. These chemicals help manage harmful pests like insects, fungus, rodents, and unwanted vegetation. However, the use of pesticides carries risks to the farm workers who use them. There are 2 million farm workers in the U.S. The U.S. Environmental Protection Agency, EPA, estimates 10,000 to 20,000 of these workers are poisoned every year from pesticide exposure. The Florida Department of Health is responsible for documenting these cases to identify trends, prevent future exposures, and help create a safer work environment for farm workers. Now, let's talk about how exposures happen and how to recognize signs and symptoms of pesticide exposure. The severity of pesticide poisoning depends on several factors: the toxicity of the chemicals in the pesticide, the amount of pesticide used, the duration of the exposure, how the pesticide entered the body, and the sensitivity of the person to pesticides. Farm workers' families are a particular concern for the Department of Health, since children, elderly, and people with health conditions may be more adversely affected. Pesticides can enter the body through ingestion, inhalation, or contact with the skin, eyes, and mucous membranes. If a pesticide is inhaled, it may pass into the bloodstream. If it is in food or water or accidentally swallowed, it can enter through the stomach. Certain pesticides can also be absorbed through the skin into the bloodstream. Anyone who applies pesticides, like pest control operators, or works close to an area during or after pesticide application, like farm workers or lawn care workers, is at risk for pesticide exposure. Farm workers are at higher risk compared to other workers due to when-high usage of pesticide in the agriculture industry, which is about 75% of total pesticides use in the U.S. Workers may also unknowingly expose their families by carrying pesticides into their homes, on their bodies, clothes, and shoes, or by washing their work clothes together with the rest of the family laundry. Acute pesticide poisoning symptoms can happen immediately or over the course of a few hours or days. Here are the most common signs and symptoms of pesticide poisoning. Mild poisoning can cause fatigue, headache, dizziness, profuse sweating, skin rashes or swelling, muscle weakness, nausea and vomiting, diarrhea, eye irritation, watering eyes, or pinpoint pupils. Moderate poisoning can cause difficulty breathing, blurred vision, chest pain, or skin burn. Severe poisoning can cause all these symptoms plus convulsions, coma, and in extreme cases, death. If you think you've been exposed, tell your supervisor. If your employer refuses to provide medical care, you still should go to a doctor or call the Poison Control Center, the Florida Department of Health, or the Florida Department of Agriculture and Consumer Services. The Florida Poison Control Center can be reached 24 hours a day, 7 days a week at 1-800-222-1222. You can call directly or your doctor can call. This toll-free number is used nationally to advise exposed workers, supervisors, and healthcare providers. They have a toxicologist available 24/7 to offer treatment recommendations, preventative advice, and information regarding potential poison hazards. Because there are so many different types of pesticides, it is important for you to know what kind of pesticide you were exposed to and how the exposure happened. Information about the chemical is on the label and should be also available on the farm or company using it. The EPA registration number, name of the product, and active ingredients are helpful to know. The information that you give to the Poison Control Center will be given to the Department of Health to document your case. You can also contact the Florida Department of Health directly at 1-800-606-5810. The Department of Health monitors and assesses pesticide exposures. Properly reporting your exposure not only helps you get the treatment you need, but it also puts action in motion that could prevent future exposures and could help other workers. You can also report your case to the Florida Department of Agriculture and Consumer Services at 850-617-7996. They will investigate possible violations that led to your exposure. You should know that there are laws in place to protect you if you are exposed to dangerous chemicals in the workplace. If you report potential harm from pesticides, you are protected from job termination and retribution, regardless of your immigration status. For more information on pesticide poisoning, visit the Florida Department of Health website below. Reporting exposures quickly will help with treatment and help create a safer workplace for you and your community. This message is brought to you by the Florida Department of Health.